Hi, I am Dr. Suvarchala. I am the Scientific Director at Ziva Fertility Centers. When we are investigating the causes for infertility, one of the most important tests that we do, in addition to AMH, FSH, the levels of estrogen and progesterone in a woman, we also look at a very important hormone called prolactin. Now this prolactin is a very important hormone that is released in a woman. It is usually elevated when a woman has just had a child and she is breastfeeding. So you can understand the correlation between a breastfeeding woman and prolactin and why it is released. It is released so that she can produce milk, and it also means that there is a correlation with the ovulation physiology also in the woman. So when she is breastfeeding, the idea is to not get her pregnant again, to give her some chance to be able to feed her child, and then after a certain period, maybe 9 months to 1 year later, her body is ready for another child after that. So prolactin is elevated while she is breastfeeding, and it interferes with ovulation. So the egg will not grow inside the ovary, it will not be released, and the endometrium will not shed, so therefore she will not have her periods. That is the cause and the effect of elevated prolactin. Now in women who are trying for a child, who are so to say infertile, and they have elevated prolactin levels, it is very clearly understood that there is no ovulation happening, and if it is a mild case of elevated levels of prolactin, the ovulation might happen. It may not be enough for high levels of progesterone. Now as you are aware, progesterone is very important for an embryo to implant in the uterus. It gives so to say, it increases the blood supply to the endometrium, which indirectly is the nutrition to the embryo. So high prolactin levels may interfere in ovulation per se. Mild to moderate may be okay in releasing the egg, but may not help in implantation because it interferes in the progesterone generation inside the endometrium and the ovaries. So that's the correlation between prolactin and infertility. So a high level means that she may not get pregnant until medication is properly given. The good news here is that prolactin can be controlled. It's a very simple treatment. Within a week of medication, the prolactin levels can come down. But there are severe causes where there are adenomas inside the brain, so proper MRI and CT could be required. But if you have more queries, if you think you have elevated prolactin levels based on your previous reports, you want to understand more how it is affecting your fertility, please feel free to contact us for more details. Thank you.